well, a little after 3:30. So we are going to dive in. Thank you everyone for attending today's Coffee and Connect. It is sponsored by Penn State Health, and we have Dr. Fallon Hughes here with us. I am Dana Shive. I am our Director of Communications and Membership, and I'm so happy to see all of you today. So I will turn it over to Dr. Hughes and let her get started.
Thank you, Dana. So I was asked to come and talk to all of you about our critical care fellowship program that we have at Hershey Medical Center, but I decided I'd broaden the topic a little bit. So I'm going to talk to you about a couple of different professional development programs we have and the impact on nursing practice. Let's see. So before I do that, I thought I'd tell you guys a little bit about me. So as Dana said, my name is Fallon Hughes. I am the Director of Nursing Education and Professional Development at Hershey Medical Center. So that's a really big, long title. And I'm not sure how many of you are familiar with the world of nursing professional development, but it is actually a specialty that's recognized by the American Nursing Association in nursing and really was recognized for the first time way back in the 1950s. So just like critical care is a specialty in nursing, pediatrics is a specialty in nursing, those of us who love to teach and develop nurses get to have the opportunity to have our own specialty as well. So I'm one of those people who growing up didn't have any notion of being a nurse. I actually really wanted to be a teacher. And then I took a couple of courses in high school that spun me in the direction of nursing. And so in kind of my final couple years of high school, decided I wanted to be a nurse. And when I found out that I could teach and be a nurse at the same time, I knew that was absolutely going to be my dream job. And so in nursing, you have the opportunity to teach in a university or a college. You also have the opportunity to teach in the hospital setting to those who are already licensed. And that's really what differentiates academic nurse educators and nursing professional development practitioners, which is what I identify as. So you'll see on the slide here, I have the nursing professional development practice model. And this is published by the Association for Nursing Professional Development, or ANPD. And really is a visual of the work of nursing professional development practitioners. And what I'm going to be talking to you guys about today in terms of our professional development programs really aligns with the application of this model. So myself and my team, we are really responsible for all of the orientation needs of any new nurses or experienced nurses that start at our hospital. We're responsible for competency management and development. So of course, annual competencies, which I'm sure you're all familiar with, but also any in the moment competencies that come up. So one of the big ones in the last couple of years, obviously, was COVID-19. Sort of overnight, we had to prepare to train all of our 2,000 nurses to care for and protect themselves and others from the COVID-19 virus. We also spend a lot of time working with nurses in the area of professional development. So as you define your goals within your career, whether it's to become a nurse practitioner or a nurse preceptor, or you want to be a charge nurse, or maybe you end up thinking you want to be a nurse educator, that's also my team's job, to help people make sure that they know what they have to do and the path they have to take in order to be successful. So I'm a huge nursing professional development nerd, and if any of you have any interest, I'd love to hear from you and chat. So I'll put that little selfish plug in. I also have Penn State Health here. I've worked for Penn State Milton Hershey Medical Center since I was a nursing student. I had the opportunity to start here in my junior year as a nurse extern, became a graduate nurse, and on up the line to the role that I'm in now. So Penn State fan, of course. And then the other important aspects of my life, I have two daughters, Lakin and Collins, who hopefully will decide to become nurses someday as well. We talk about it quite frequently already. And then this little guy here, I have the official grumpy cat who lives with me. His name's Max, and he's been with me through my master's degree and my DNP. So he's also an important part of my journey. And with that, since we have such a small group, I would love to hear where each of you are at in your nursing career at this point, if anybody's willing to share. Looks like Megan raised her hand. Go ahead, Megan. I think you're muted.
Megan, can you hear us? While we may wait for Megan, Mary, would you like to share?
Yeah, I'm kind of at the opposite end of, I guess, the career spectrum in terms of education. I'm an associate dean for academic affairs at Jefferson College of Nursing. So I think I've seen a lot come and I've seen a lot go. You know, if you stay in nursing education long enough, you just see the trends kind of start to recycle again. But I guess my area of the area that I spent most of my time on was undergraduate education for so many years. So the whole area of graduate degree, APRN requirements and DNP programs is relatively new to me. I've done it now for about 3 years. And now even trying to explore opportunities to think about fellowships that get accredited, you know, for nurses over in the health system.
Yeah, very cool. Nice to meet you.
Nice to meet you as well.
Anyone else willing to share? Oh, I've got some chats. Okay, thank you. Oh, Peter, we're in the same family. Okay. Very cool. 3 classes to go for your DNP. Congratulations.
Yeah,
It's a good feeling when it's over. All right. So let me move on here. I want to ask the question before we kind of dig into our fellowship program here and some of the other things I wanted to talk about. What value do you place on professional development? So what does professional development mean to all of you in the importance of your career? Any thoughts there? Self-fulfillment. Yeah, that's great. Thank you. Peter said he enjoys helping nurses learn and give quality care. Agree with that. The continuous learning opportunity. Evidence-based practice. Yeah, absolutely. I thought it was really interesting. Professional development is critically important for the faculty role, licensure, and accreditation. Absolutely. So professional development is, we've got requirements, right, from the state for our license, for certain certifications that we hold. So in one aspect of things, we know we have to do professional development. On the other aspect, of course, my hope as a director of nursing education is that you all want to do professional development. So my job at the Med Center is to ensure that my team is developing and implementing professional development programs that not only meet the mark in terms of licensure and certification requirements, but also are engaging and enjoyable for nursing staff to participate in, and ultimately are going to improve our patient outcomes. And this is another topic that I would challenge you all to consider throughout your career as you migrate to different jobs. If you're not asking what the professional development benefits will be, please make sure that you do so. I have nursing friends all over the country who have all different levels of professional development benefits depending on where they work. This is something that an organization should want to invest in. So definitely put that at the top of the list when you're considering job changes. Okay, so just wanted to share with you guys some models for ongoing professional development. And some of these I'm sure you've heard of. So transition to practice programs, I'm willing to bet many of you have gone through a graduate nurse residency program. And graduate nurse residency programs have been around now for 20 years, perhaps a little more, and really are meant to support the student transition to professional nurse. And we know that after the initial honeymoon phase of that new registered nurse job, most of our graduates go through this crisis period of, oh my, what did I get myself into? I'm not sure I really meant to do this. And reality sets in. That's really the purpose of a graduate nurse residency program, to support a new nurse through that potential crisis phase, get them over the hump and back to the feelings of confidence and competence. So most transition to practice programs that focus on graduate nurses are meant to develop professionalism, communication, and leadership. And so at Hershey, we very recently sought out and achieved accreditation of our graduate nurse residency program, which really highlights to our applicants and those who are interested in coming to work here that we have an exceptional or a gold standard graduate nurse residency program. So that's something that, again, I'm willing to bet a lot of you are familiar with. Another ongoing professional development program is a fellowship program. And so I'm going to talk to you a little bit about our critical care fellowship program today. Fellowship programs tend to focus on a specialty. So a graduate nurse residency program is going to focus on all aspects of nursing, regardless of the unit or the patient population or even the setting. We've actually had outpatient or ambulatory graduate nurses in our residency program, but fellowships tend to be more specific. So And fellowships occur in the nursing setting, and they also can be in place for APRNs, like nurse practitioners. Physicians have fellowship programs for particular specialties. What I'm going to talk about today is specifically a fellowship program for the role of a registered nurse working in a critical care setting. We also have transition programs for experienced registered nurses. So our transition to practice program is specific to the newly graduated nurse. But what we found over several years of data collection is that an experienced nurse is not an experienced nurse is not an experienced nurse. We all come with different backgrounds, different exposures, even different school competencies, depending on the state that you may have completed your program in. And so we would interview and onboard experienced nurses into a particular unit and find that the transition from perhaps a community hospital, a long-term care facility, or really any healthcare model different than a large academic medical center like we have here was very, very challenging. And we had nothing special or unique to offer these folks, again, to provide that buffer. So we developed a transition experienced registered nurse program, which I'm going to talk about a little bit in more detail. And then lastly, we've got all of our other nursing continuing professional development programs that can focus on topics from very clinical, patient care specific topics to wellness, to ethics, which has been something huge for us in the last couple of years. And really, we should be using data from our organization to guide the necessary nursing continuing professional development that we need. So we look at our patient outcomes data, we look at our patient experience data, we look at our safety events, we look at what staff are telling us. And that's how we complete our needs assessment to determine what nursing continuing professional development programs we need. And quite frankly, that is how we ultimately developed our fellowship program and our transition experienced RN program as well. So to talk a little bit more in depth about our critical care fellowship, and this slide has a lot of words, so I apologize, but I wanted to give you like the quick snapshot overview. Our critical care fellowship is a year-long program, so it is a huge investment in our nurses. It's a year-long program that spans a multitude of different critical care topics, which I'm going to share from hemodynamics through ethical considerations, leadership development. We pull this group of nurses together every month and host a 4-hour class that presents all sorts of different topics to broaden knowledge, keep learners up to date on evidence-based research, which is key because what we're doing today, what we know is the best thing to do today, may change a year from now. What you learned in school may have already changed. So ensuring that our learners know how to keep up to date and have the ability to do that, particularly in the area of critical care nursing for this program. And then the other key element is that this program offers time to engage with peers in other critical care areas. So that's where you sort of get that title of fellowship. We keep the same nurses together for the classes so that they develop that camaraderie. We use all sorts of different teaching and learning methods in our fellowship program, like lecture, case studies. We love technology for audience interaction. And then, of course, hands-on, because let's face it, critical care nursing is certainly hands-on. This slide here just kind of outlines for you the different topics that we include in our fellowship program. So again, this is a year-long program that meets monthly. So the topics change each month, and there are 12 in total. Now, I also wanted to highlight for you that some of these topics are actually not taught by nurses. We bring in other key members of the healthcare team who are experts in that particular area, like a respiratory therapist or our trauma program manager, who can really speak to things like our standards of accreditation and how our outcomes are measured in that particular area, as well as that interdisciplinary collaboration. Now, one important key thing to point out about this fellowship is not intended for a brand new nurse. So our graduate nurse residency program is how every nurse that we hire, regardless of specialty, is going to spend their first year. A fellowship program is really intended to grow an experienced nurse, a nurse who has some experience in a very particular specialty. So that's key and really important to understand. The information that's being shared, the learning that's happening in the fellowship is not introductory. You have to have a foundational knowledge and some experience in nursing before being immersed in this type of fellowship program, because it is, on the Benner's novice to expert scale, you're definitely more in that competent area whenever you're engaging in a fellowship that is specialty specific. The other thing that I'll point out is that there are a couple of topics that are not specific to clinical. So we have a whole session where we talk about ethics, and ethics in the critical care setting, I think more so than any other, is it's critical that our nurses in those areas feel competent in the aspects of ethics, but also in the ability to speak up, to talk about ethical issues, to share experiences with moral distress. I'll never forget, a number of years ago, I had a family member who passed away here in one of our ICUs, and some of the things that happened over the last couple of days of his life, I thought, oh my goodness, the number of ethical and moral distressing challenges that are occurring around me are almost too much to handle. And I myself am not a critical care nurse, and that solidified for me exactly why I'm not. But that's an important topic. And then we also talk about synergy. So we talk about the system, so systems approach to healthcare delivery, interprofessional collaboration, professional development, and how important that is in your career, but also ultimately the quality of care that you're able to provide patients. So while the primary focus is growing a competent nurse to be an expert nurse in the specialty of critical care, there are other aspects that we like to include to develop the individual professionally as well. Our transition experienced registered nurse program, I wanted to talk to you briefly about this as well. This is really, as I said, designed again for experienced nurses who are moving into a healthcare setting such as this one, a very large academic medical center with lots of centers of excellence, trauma, and the interdisciplinary complexity that occurs here. So this program was developed to support experienced nurses coming in who may have never worked in that type of setting before. So much like you're all used to, these nurses go through our typical orientation program, our standard orientation program, and then of course their unit and specialty specific program. But then we layer the turn program on top of that. And the turn program gives these nurses the opportunity to engage in some simulation-based learning. We do policy review, we do discussions around communication and courageous conversations. We talk about escalation of care. We talk about conflict management and leadership. So again, experiences and competencies that are critical when you're working in a setting that is rather complex compared to maybe some of our other care settings. So, and this slide doesn't look as great as I wanted it to, but just wanted to share with you some of the mission and goals of this program as well, since it's somewhat unique. Of course, our fellowship program and our turn program have the primary goal of attracting and retaining exceptional nurses. That's why my team exists, and that's why we do what we do. We want to have the ability to recruit the best of the best and prepare them to provide exceptional patient care. There's also a goal of engaging folks in continued professional development so that they continue to have that spark and desire to learn, right? If we're not offering and investing in folks, it's pretty easy to lose that spark and that interest. Enhancing clinical judgment and leadership skills, and then of course, supporting advancement into clinical leadership roles. So how do we know this stuff works? Any ideas how we measure the outcomes of our fellowship program or our turn program? Retention, yeah, absolutely. That's something that we certainly measure. Any other thoughts? Performance scores, yeah, that's a great point. I'll say our primary objective measurement for the critical care fellowship program is the BCAT. And for those of you who aren't familiar with the BCAT, it stands for Basic Knowledge Assessment Test, I think. And there are different versions of it, but there is one specific to critical care nursing that we use. So we actually measure, what's Dana's BCAT score at the beginning of the fellowship program and what is her score at the end of the program. And of course, our goal is we're going to see a significant improvement in her score. And that's how we know that her engagement in that program was successful and she is leaving the program being a more knowledgeable and better skilled critical care nurse. So that's obviously one objective measurement tool. Subjective, of course, we ask our learners, did you like participating in this program? Do you feel like an expert critical care nurse now that you've completed the program? And then, as others mentioned, retention is certainly important. Also, all of our patient outcomes. So the things that we measure, particularly in the critical care setting, like ventilator associated events, things like unplanned extubation, obviously hospital acquired pressure injuries, infections. We expect that with the organization's investment in this program and our nurses, we are going to improve those scores. And so that's my responsibility in my role, to highlight and showcase the benefits of the program to our senior leaders. With our TURN program, again, we have knowledge assessments that we use, but our primary measure of success with that program is definitely retention. We found that with our experienced nurses who we were hiring that were coming from settings not quite as complex as Hershey Medical Center, we were losing many of them, and by many of them, I mean the majority of them, within their first year of employment, because they were overwhelmed. We were giving them a standard orientation that we would give to any experienced nurse with no additional support. So our ultimate goal for that program is to get them to the point where they have the confidence to work in this type of setting. And then, of course, they stay and want to continue to work with us. So in any sort of professional development program, whether it's a fellowship program or it's a transition to practice program, or even a small nursing continuing professional development program, outcomes are key. These programs cost organizations money. It costs to send employees to participate. And so we have to be able to show on the back end that these programs are absolutely worth the investment. And so that's another, I'll say, important aspect of my role, and something that you should consider anytime you're moving into a new organization. The last thing that I wanted to talk to all of you about as it relates to a fellowship program or an experienced nurse program or even a residency program is this concept of communities of practice. So anybody ever hear this term before or know what a community of practice is? Any thoughts there? You'll remember back on the first slide where I introduced fellowship, I talked about that peer-to-peer connection that we like to create as part of the fellowship program. So Tony says, yes, generally an informal group, experts and novices. Yeah, that's a great way to describe it. I just highlighted for all of you some of the key concepts of a community of practice. So this is, and it can be formal or informal, but it's a group of people who share all of these things: a common purpose, common goals, willingness to learn from one another, sharing ideas with each other, support and encouragement, sharing challenges. This is another critical aspect of our fellowship program. Working as a nurse in general is challenging, right? Working in a critical care setting brings a special host of challenges that I believe requires any nurse to have a community of practice, whether it's a formal community of practice through something like a fellowship program, or an informal community of practice in, some mentors and friends on the unit. And I would suggest that those of you who are part of the young nurse professionals group, you are a community of practice that you've formed among yourselves through PSNA. And throughout my nursing career, whether I've been involved again in a formal or an informal community of practice around my areas of interest, it has been certainly the most impactful area of my development and my mental well-being as well. So that's another huge component of our fellowship program that I really didn't want to forget to mention. Okay. And that is what I have for you guys. So I would love to hear any thoughts, questions, ideas, things that you've seen in other organizations similar to this, or anything that I didn't address that you have questions about. Pay attention to the chat here.
Megan's raising her hand. Let's see if it works this time.
Can you hear me now?
Yes, we can.
Woohoo! Okay, perfect. Sorry. So I guess my question is, for your graduate nurses, first question, do you hire graduate nurses into your ICUs at Hershey? And then you said that this fellowship is not meant for our new nurses. So how does that work with having their initial graduate nurse residency and this fellowship program?
Yeah, good questions. So at Hershey, we hire graduate nurses nearly everywhere. Current state, the only area that we do not hire graduate nurses is our peri-anesthesia units. So our adult PACU and our children's hospital PACU. But all of our ICUs, IMCs, and as I mentioned, we have even hired graduate nurses in some of our ambulatory clinics. Depending on, typically those are folks who were LPNs in their prior career and really desire to remain in the ambulatory setting. But yes, otherwise we have GNs in all of our units. And I'll say, I think not much different from all of our peers in healthcare. Almost half of the registered nurses we hire on an annual basis are graduate nurses. So they are a huge portion of our workforce. And then your second question, so the way that this would work for a graduate nurse moving into critical care, we have a pretty specific critical care program, orientation program for our graduate nurses. That program is designed to provide the foundational knowledge to enter a critical care setting. So GNs are moving through that orientation program parallel to the nurse residency program. The fellowship would be something that those nurses could engage in after they've gotten perhaps a year and a half or 2 years of experience in a critical care setting. They could then engage in the fellowship. Does that answer your question?
It does. Thank you.
Awesome. Any other thoughts or questions?
I just put this in the chat, but I also have your ad up, Fallon. So
Great.
if you scan the QR code, it will take you directly to the Penn State Health job openings.
Thank you. Yeah, and I'll go ahead and put my email in the chat box. So if anybody is interested, feel free to email me, whether it's about a job or if you're just interested about anything that I talked about, or you're interested in becoming an NPD practitioner. I'd love to chat with you. So I put that in the chat box as well. Any other questions or thoughts? I Thank you guys for having me today. I know that we all have very, very busy lives right now. So I appreciate those of you who were able to join, and hopefully you learned a little something. And like I said, feel free to reach out to me if you want to chat any more about any of these topics.
Well, thank you so much, Fallon. We at PSNA really appreciate it. Like I had said, this is sponsored by Penn State Health, so we are so happy to have them here today. Please scan the QR code if you're interested in going to those openings. I will also email out this information as well as the recording of today's presentation. So if you want to go back and re-listen to anything,